Assalamu alaikum and welcome to Medicour on IQRA TV. I'm your host for today, Rabina Mia. And today we're going to be talking to one of our nursing staff who works in your GP surgery. In the hot seat today, I've got Anna Hemmans. Yeah. And Anna's a practice nurse. So I guess what I want to ask you, welcome first of all, Anna.
Thank you.
Is what is a practice nurse and why did you become a nurse?
Okay, why did I become a nurse? I came to Leeds University about 14 years ago to do microbiology.
Okay.
And I studied that for a year. It was incredibly hard and I didn't really enjoy it. I was looking down a microscope all day and I thought, this is not what I want to do. And my mum is a nurse and I thought, I do not want to turn out like my mum. I thought, no, stick with it. And then a friend of mine became really poorly and I saw how the nurse was with her and it was like a light bulb just went off and I thought, that's what I want to do. That's what I want to be.
So she inspired you where your mother did.
No, I just didn't want to learn. Anyway, I have turned out just like my mum and that's life. And so that's why I became a nurse. I'm a practice nurse. I used to be a staff nurse. So we've got different types of nurses.
Yes.
Yeah. So when I first qualified, I was a registered nurse and I chose to work in the hospital. And that's your staff nurse. And so you work with doctors and you're looking after people while they're in hospital and with the needs they have while they're in hospital. Mm-hmm. Now I'm a practice nurse, which is where I work in a GP surgery with GPs. There are other nurses that work with us, but we don't see each other because we're constantly like ships that pass in the night. We don't really spend any time together. So it's more kind of a role where you work on your own.
Okay. So you've done a lot of training.
Yep.
And your uniform is blue. Does that tell us something?
Now, it gets a bit confusing here. So in hospital, you have different levels of nursing and they all wear slightly different uniforms.
Yes.
And different hospitals, they all have slightly different. So.
Yes.
In Bradford Royal, the nurses might be wearing different uniforms to in the Leeds teaching hospitals. Okay. So it does get confusing. You have a healthcare assistant, okay? They don't do like a degree, they don't do specific training, and they're not a qualified nurse, but they help with the more basic needs that you have while you're in hospital. Okay. So they're in one colour, quite often green, sometimes white. When you're a registered nurse and you're a staff nurse in the hospital,
that means you've done a degree.
That means you've done a degree, yep. Then you're in like a blue and like a sky kind of blue.
Yep, the light colour.
That's it. Yep. When you're in, this is all in Leeds. I don't know how it is in BRI, but this is how it is in Leeds.
Or even around the country.
Or even around the country. Yeah, changes. So that's your staff nurse level. Now, if you become a junior sister on a ward, your uniform changes again, and it's sometimes to a more of a royal blue kind of colour, quite a bright blue. And then if you're even higher up and you're a senior sister, you go into a darker blue, which is kind of this colour here.
Okay, because I used to associate that with district nursing in my youth.
No, district nurses, again, it just depends. They tend to be in the staff nurse colour kind of uniform. In practice, in general practice, it changes because each GP surgery buys their own uniforms.
Right. So that's why we're confused.
So that's why we're all confused, yeah.
Okay, but the thing is, it's a nurse's uniform.
It's a nurse's uniform,
okay.
Absolutely.
So what does a nurse like you're a practice nurse at a GP surgery, what do you do every day?
What I do every day is a lot, so it's very, very varied. So people come to see me, they're called in every year if they have a chronic health condition, something like chronic obstructive pulmonary disease.
Okay, now when you say chronic, what does that mean?
So what that means is if you've got a health problem and it's something that you're living with every day, that's a chronic health problem. Right. And some of them we would like to see every year to see how you're getting on. So asthma, I see people with asthma and I do a full review and look at how they're managing. People with this chronic obstructive pulmonary disease, diabetic people. So we try and see those every year or sometimes every 6 months. I see ladies to do smear tests. I do a particular breathing test that helps to diagnose if you've got asthma. That's called spirometry. I vaccinate babies.
Right.
And I also provide vaccines to adults, particularly if you're travelling.
Okay.
I do blood tests. I do blood pressure. A whole different raft of different things that I do.
So a lot of this sounds like the kind of things we associate with the doctor. So what can't you do? So
what I can't do is I can't prescribe. So I can't go, okay, you're not doing too well at the moment, I can't prescribe you this drug. That's what a doctor needs to do. And sometimes if you've got very, very complex issues that are a bit above what I can do, I can't do those either.
Okay, but we do have nurses that prescribe as well,
we
don't
do, and that might be where I go in the future. It's where I do a prescribing course. You do a master's at university, and that means that you can then prescribe drugs just like a doctor.
So you've talked about reasons why people might come and see you, and I know that's one of the things I want to explore with you further in today's show, and we're going to look at diabetes and asthma and all the others. But what I wanted to also ask you is that do you have more time than a doctor?
Yes. generally speaking, yes. So most GPs get about a 10-minute slot, which is not very long.
No.
So you go to them with a problem and they've got to get you in and out, ideally within 10 minutes. For me, I get longer. So if you're coming to see me about your diabetes, you get between 20 or 30 minutes, depending on whether you need blood tests and things. If you're coming to see me about your asthma, you get 20 minutes. I get 20 minutes with you. If you're coming for a smear test, you get 20 minutes. And sometimes I take longer than that if that's what's needed, which means I run late. So I'm sorry for patients that are sat waiting to see me, but that's why. It's because sometimes I need to give people a little bit more than the time I'm given.
And I guess we need to appreciate the fact that if we're waiting to be seen and we're waiting slightly longer, then it means that I interpret that as that you're being more thorough.
That's it. There's a reason for it. Some people come and see me and everything's going really, really well, and I can give them a few ideas and they can be in and out of the door in 10 minutes. Some people, they've got a whole lot going on and we need to talk a lot, and that means that we take a bit longer.
Sure. So I know I want to talk to you about the diabetes care and the asthma care and the blood tests and things, but before I ask you about those in particular, I just wondered, how do we as patients get the best out of our nursing staff?
Oh, that's a tricky question. How do you get the best out of the nursing staff? I think one key thing is honesty.
Right.
So when I'm talking to people about the life that they lead and about what they eat and what exercise they do, if you're not honest with me, then I can't really give you the best advice.
Are you telling us that we're fibbing?
Yeah. So sometimes people and they do say, oh, well, I haven't told anybody this before, but, and that's also true of people who are drinking alcohol, maybe have an alcohol problem, people who smoke, and people who might do drugs. I can't really help if I don't know. So I think
don't take the medication.
Oh yeah, that's it. Or don't take the medication. Not that I'm looking at you.
Don't look at me for that one.
But if you're not honest, then the amount of help I can give is really limited. So I think that being honest, I think that's the most important thing.
That's a really powerful message, actually, because I think we underestimate the importance of that. And actually listening to you there makes me realise how we do need to recognise that if we want you to give us the best care, you need to know what you're working with.
And I'm not I'm not making a judgment. I'm not seeing somebody and going, well, you shouldn't be doing that and having that really isn't the case. But if you tell me everything that you can tell me, I can look at what I can try and advise on. Yeah.
Because I think a lot of the lifestyle questions that we get asked about diet and smoking and alcohol, you know, they can seem really invasive and nosy questions.
They really can.
And I know when I'm talking to medical students a lot of the time, I'm saying you need to make it relevant to why you ask those questions. Absolutely. Because actually, if somebody off the street came and asked you those questions, you wouldn't share that information. Yeah. So you need to be able to explain that actually by you sharing that information with me as your healthcare practitioner means that I can ensure that the care I give you is best suited to you. So it is about that, isn't it?
And the other thing I'd say is don't be scared. So some people come into me and I can tell by their face they're absolutely terrified. I don't know what they think I'm going to do, but don't be frightened about coming and seeing your nurse and having these honest conversations. No judgments are going to be made against you. I'm not going to be slapping your wrist and telling you off or anything like that. That's really not the case. We're just going to have an honest discussion about, you know, how I can help you.
And I guess that's how we get the best out of you and you get the best out of us as well. Okay. Can people choose which nurse they come to see?
Yeah, I believe so. Now, every practice has a slightly different, so again, each GP practice is a separate business and they all run a little bit differently. But at my practice, if you ask to see me, absolutely you can see me. Some nurses have a longer waiting list than others, so it depends how quickly you want to see me. I'm normally booked up about a month in advance, so you'll have to wait a little while before you see me rather than somebody else.
Okay, and I guess some nurses have got further training than others, like I know for a fact that you've done so many courses, which is why you can talk to a variety of patients with long-term conditions. So I want to talk about some of those long-term conditions. So let's say, for example, I came to you as a diabetic. How would you work with me?
How would I work with you? Okay, you'd step in through the door, and I think first off I'd ask you about how you feel about being diabetic, how you manage with your diabetes. Now some people say, well, I feel absolutely fine, I don't make any changes, and that starts off the discussion really, because that's what we need to work on. Some people are very worried, are very scared, they're scared about the tablets. So I think it's a really important thing to first off find out about how you feel about having this condition and what that means to you. And then I do your blood pressure, I do your weight. I may take a blood sample if that's necessary. I measure around your waist. Nobody likes me doing that, but all that information shows me if we've got any problems with your weight. Do we need to be working on that? Are you underweight? Are you overweight? What's your blood pressure like? Is it too high? So it gives me some more information that I need. And then we start to talk about things like, do you smoke? do you drink any alcohol? Again, this is all just general information to show me where do I need to focus my attention here.
Sure.
And then
you're not going to share this information with anybody?
Completely confidential. Nobody sees
so
this.
I want to just explore the confidentiality element of this, because I think not everybody within our community actually appreciates what that means. So how would you define confidentiality?
Confidentiality means that basically nobody will be seeing any of your information unless they have a direct involvement in your care.
Including the receptionist at the front desk?
Including the receptionist at the front desk. Now, the receptionist will be able to access your record, but to be honest, they're not going to go nosing through your record and looking at the information. They are far too busy. I don't know how often you've been in the GP surgery, but they're far too busy. They need to be able to access your record. If you say to them, I need more of my tablets, they need to be able to access your tablets and print off the prescription for the doctor to sign. So they can access that information. Yes, they can, but they won't. They have their own code of conduct and ethics, and they will not do that. The only people that will look are the people that are involved in your care.
I think when I worked in the community in my early part of my career, I remember, particularly for our members of our community who didn't speak English as a first language, I needed to have to explain confidentiality. And I used to break it down in the context that if I share information inappropriately with people that are not entitled to see it, it's so serious I could lose my job.
Yeah, absolutely.
And
it's huge. Yeah. You don't... And confidentiality is a huge issue within healthcare. So I get home at the end of the day and I've had a really difficult day and I've seen some things that have been really difficult. I do not share that with my husband. I don't talk. I would never expose anybody's name. I would never expose anybody's I'd never give any information about any individuals to anybody that's not involved in their care. It is 100% confidential.
And this is so crucial, isn't it, to that relationship of trust we need with our healthcare professionals.
Absolutely.
And there are things that as patients we can do if we feel somebody is not respecting those rules around really confidentiality, that we can actually make formal complaints about that, and that would be tackled very seriously.
Very seriously. This is a huge issue, and I think you need to be able to have some trust in our confidentiality, because if you're going to be talking to me and giving me this information about yourself, you need to be able to trust that I'm not going to tell anybody about it, and I'm not. And I have dealt with people of all kinds of backgrounds, with all kinds of with criminal histories, with all sorts, you know, and I've never ever exposed any of that, and neither of my colleagues. We would never ever do that. So don't be worried about confidentiality at all.
Yeah, I know I'm expanding on this slightly more than perhaps we would normally, and I think it's important because I think a lot of the time healthcare professionals are trained to understand the purpose of confidentiality and what it means and the context of it. I think as communities we don't often get that shared with us, and I think lots of our communities worry about whether they've got an interpreter or they've got somebody from their community working in the GP surgery, and whether or not their business is going to be private or not.
And it absolutely will be. I can say that without any doubt. It absolutely will be. The only time that information is ever shared is if you tell me something that means that your life is at risk. Okay. And then
or somebody else's.
Or somebody else's. Yeah. So if that happens, then I will have to talk to somebody about that, but it won't be with Peter from the shop around the corner. That will be with a healthcare professional involved with mental health that I will want to be able to see you.
And I think what's important to say to the community is that if you do ever have concerns about confidentiality or what it means or how it's sort of sustained within your healthcare, ask the people who are looking after you.
Yeah.
Ask them to explain what they do about confidentiality.
And that's true of anything. If you've got questions about anything like this, rather than just letting it stop you from coming and seeing and talking to people, ask. You know, if you've got questions, ask. It's never ever a problem. I take phone calls all day from people and it's not a problem at all.
That's really helpful. I know we sidetracked a little bit there. I thought that topic was important that we covered it. So we were talking about the care of diabetics, and you've already said that, you know, you'd start to get to know that person, how they're managing it or how they're feeling about it.
That's it. And then I would look at their previous blood test results. So how somebody feels about how their condition is really important, but the numbers sometimes can also be very important. So if I look at somebody's reading for their blood sugar and it's very, very high, that's important because something's not quite working as well as we want. So I look at the previous results and then we talk about those, and we talk about, you know, so what changes do you make with being diabetic? And I go through people's what they eat in quite detail. So I say, what do you have for breakfast? What do you have for lunch? What do you have for tea? Do you snack on an evening? Because a lot of people do. You know, you have to be, again, this is the honesty. So I'll say to people, you know, and what do you find difficult? You know, what gets you? Is it chocolate? Is it cakes? Is it biscuits?
Is it everything?
Yeah, so it's everything, yeah. So we go through all of that, and from that I can tailor advice. So if people are missing breakfast, we start talking about why. What kind of things would you like to have for breakfast? Something small, and I try and suggest things which are the healthier options. If you love biscuits and you're finding biscuits incredibly hard to give up, rich teas, for example, are lower in sugar than a digestive.
Yeah.
So it's trying to suggest something that's a little bit, I'm not saying cut all of that out, you know, you've got to live like a monk and you can't eat any of that. I'm not saying that. I'm saying let's swap these things to something a little bit better for diabetes.
And I know after the break we're going to have a longer conversation about diet and tips that we can give to how you can replace the things we enjoy to healthier options. So hopefully we'll talk about that in more detail. Thank you. So anything more about diabetics that you...
Yeah, other things that you will, if you go and see your nurse at the practice about diabetes, she will look at your feet. And this is something that you, hopefully it will explain it all in the letter that you'll receive, but your feeling and your blood supply to your feet can sometimes be altered through diabetes, and so part of what I do is I have a quick look at that. So I'll take off your shoes and socks and I'll feel for a pulse, and I'll also just prod your feet with a little bit of like plastic fishing wire just to check your sensation in your feet.
That's
and I'll
not painful?
No, not painful. It's not a needle, it's just a little bit of plastic. It's a bit like what you put tags on clothing with, a bit like that.
Yes.
And then I'll just check your feet thoroughly. If for example your toenails are really long and you're struggling to trim them, or you've got really hard bits of skin, I might refer you on to the podiatrist, which you get completely free as being
the person
diabetic.
who's the expert in
That's the person
feet.
that looks at feet, yeah. And then I'll also talk to you about little tricks to help you manage with your feet. So for example, never walking around barefoot and things like that.
Okay, really helpful. So how important is it for a diabetic to know about their blood sugar levels and all the rest that you get thrown at? Because there's a lot of information.
Oh, there's a huge amount.
Oh
no, it's a huge amount of information. So we do this blood test to check on how diabetes is getting on. We take a blood test that looks at 3-month average of blood sugar. So it's not me pricking your finger and seeing what you had for breakfast or something like that and what your sugar level's doing. It's an average over 3 months. And I think that's really important for you to know, because if you are following a really, really good diet and you're doing everything you can do, but this sugar level still remains high, it's really important that you know that, because it may alter what medications we put you on.
Yeah.
And things like that. And I've had some patients who have come and seen me and I've gone, gosh, this blood sugar level's really high. And they said, well, I've not taken any tablets for the past 6 months, and there might be reasons for that. So I think it's important that we talk about that result and that you know what it is.
Sure. And I know we've got programmes that we've already done with Dr. Liz about diabetes, so if anybody's not seen those, I'd certainly encourage you to go onto YouTube and watch
Dr. Liz
those.
she's amazing.
She's
so
our
it's definitely
expert,
worth watching. Yeah.
As she calls it, she's the diabetic queen.
She is the diabetic queen, yeah.
Okay, I don't want to spend too much time on diabetes because
Absolutely,
we've got
that with
others.
Liz. Yeah.
What about asthma? How do you look after asthma patients?
So how do I look after asthma patients? So somebody comes to see me about their asthma on that yearly check, or if they're having problems, they come and see me before them. And we do a measurement called your peak flow, which where you're taking a really deep breath and you blow out into what looks like a toilet roll tube. And it looks at how much air you can breathe out of your lungs in one go. And that gives me an idea. I compare it to the year before and I see, is it about the same? Is it worse? If it's worse, why? And we look at things like, have you got hay fever? Are you using your inhalers? A lot of people, because people haven't explained to them how inhalers work, they're not taking them every day like they should. Okay. So this gives us a chance to talk about that. I talk about what to do if your asthma gets worse, which is really important. So if your asthma gets worse, sometimes I will say to increase the amount of the inhaler that you're on. Sometimes I'll say, just come and see me. And I'll also talk about how to recognise an asthma attack and what to do in an asthma attack.
Is that something we should talk about now?
Well, it's up to you.
I think that'd be useful.
Yeah, so an asthma attack. Yeah. So an asthma attack it's not where you're breathing just a little bit worse. It's where you just feel like you cannot breathe. You can't walk from here to there. Okay. You can't talk in full sentences. Your chest feels incredibly tight. Some people go quite red in the face. You just feel like you can't breathe in. Really frightening, really, really scary. If that happens, you will have a blue inhaler called a salbutamol inhaler. It's a blue inhaler. Nearly every asthmatic's got one pretty much. You can take up to 10 puffs on that blue inhaler. It's not going to do you any harm. It's not like an overdose. You can take up to 10 puffs. You might just take 7 and actually you feel like you can breathe easier after 7. If you can, that's brilliant, but you must see your doctor or a nurse that day because something has gone on to lead to this, so we need to find out what it is. But if you take up to 10 puffs on that inhaler and you still can't breathe, it's 999 time.
Okay.
And this is really, really important because unfortunately people do die of asthma, and we know that. And we've looked into this huge study as to why people die from asthma. And the reason is because nobody's talking to you about what inhalers you use, why we prescribe you those inhalers and the importance of using them, and then what to do if you do end up with severe asthma.
Because it's the blue and brown inhaler.
Oh yes, well this is a bit, are you ready for this? This is a big topic, yeah?
Well, as succinctly as you can, because I don't want to spend too much time on it.
Okay, so you have two inhalers. You have a reliever and a preventer inhaler. So you have a steroid inhaler, and that's what you take every morning and every night. That's a preventer inhaler.
Is that the brown one?
That's the brown one.
Okay.
Normally brown, yeah. And so what this steroid inhaler does is you've got all these little tubes going down to your lungs, and in asthma something irritates the very, very delicate lining of these tubes, and as a result the tubes tighten up, and that's what asthma is, where you feel like you can't breathe. The steroid tells the lining of the tubes, calm down, it's all okay, and they relax. And that's why you need to take it every day. Now sometimes, even though they're relaxed with that steroid inhaler, something can still cause the muscles on the outside of these tiny little tubes to tighten. Things like cigarette smoke or perfumes. So you feel like you do have this wheeze, or you're coughing, or you feel like it's a little bit hard to breathe. That's your blue inhaler. And that only acts for about 4 hours, and it just gets these muscles to relax and open up. But if you're using your steroid inhaler every morning and every night, this will happen less and less, and ideally once a week or so.
So that loosening allows more oxygen to come through, and then you're not going to struggle.
And you don't get the symptoms, you know. So if your asthma is being managed correctly, you get very few symptoms, you get very few flare-ups of your asthma, and that's how it should be. And that's if you're using your steroid inhaler as prescribed, morning and night.
Okay, and I guess if you're not sure, then you need to talk to your nurse.
Then you need to come and see me.
Yeah, okay.
Or somebody like me.
So, yeah, your practice nurse. Yes. Okay, and what about age ranges? I mean, is asthma something that is managed differently for adults and children?
Slightly. So the inhalers that you use to prevent your asthma, the one that you use every morning and every night, has got some steroid in it. Now, this isn't steroid that gives you muscles and makes you strong. It just goes into your lungs. But with children, because they're growing, this steroid can potentially reduce their growth.
Right.
So we don't give it unless we kind of need to.
Okay.
But if we need to, we definitely do. So all the symptoms are exactly the same about if it's getting worse or if you're getting an asthma attack, that's exactly the same. And the treatment is more or less the same, but we don't jump to a steroid inhaler as quickly in children unless we really need to.
We seem to be coming up to the break already. I
Wow.
can't believe where the time's gone. I do this every show that I'm on. I'm always talking about how time goes so fast.
It feels like it's been 5 minutes.
Yes, it has. So inshallah, we're going to come back after the break. We've got so much more to talk to Anna about being a practice nurse and all the things that she can help you with. Inshallah, we'll see you after the break. Assalamu alaikum.